Hi, I'm Amy, and now I'm going to show you how to do IV push chemotherapy administration. So I am going to get my chemo ready over here. I have my EquiShield device. I'm going to start by putting that on my chemo tubing here. So scrub this. Now I can get my chemo out of the bag from pharmacy. It has the EquiShield device on it as well. I'm going to program my pump with saline running at an infusion rate of 150, just so that I have some fluids running as I do the IV push. You always want IV fluids running. So now that I've got my IV fluids going, I'm going to go ahead and connect my chemo here. So I'll scrub this hub. And I'm going to connect red to red. Didn't have as good of a click sound, but I can feel it engage there. Oh, forgot to unclamp here. Go ahead and hit restart. All right, so now that I have my IV fluid running, I'm going to push a few mils, and then every couple minutes, 2 to 5 minutes, I'm going to pull back and check for blood return on my line here. So you want to make sure you constantly have blood return when you're doing IV push. So you're just going to slowly kind of clock watch, do a couple mils, and then check for blood return. It's hard to see here on my blood return. Don't be alarmed if you get a occlusion alarm on your pump. If you're pushing really quickly, it might put some pressure in that tubing and alarm on your pump. Just go ahead and hit restart. So we're pushing and we're checking blood return. It can be kind of a slow process here. Most of these IV push are over 5 to 10 minutes. So go at your ordered speed here. You're just going to continue pushing and pulling back for blood return. Periodically to check for that blood return. And again, you'll want to check every, mil or 1 to 2 mils for that blood return. So once you empty your syringe, you want to give the pump a few minutes of flowing through to get that line cleared just right here. And then once you've seen a couple mils, maybe 5 to 6 mils go by, you can go ahead and turn off your pump here. And at this point, you can disconnect here from your EquiShield, pulling straight off. This will go into your chemo waste bag here. And then you would unhook the patient from the line per policy and doff your PPE. Now that our chemotherapy infusions are all complete, I'll show you how to disconnect from the patient and dispose of your chemotherapy tubing. So I'm going to take my spill pad here and slip it underneath my line, just in case there are any drips. I'm going to get my saline ready. If you want, you can use a little piece of gauze when you unhook the tubing here. So I'm going to lay that on my spill pad there, get my alcohol swab ready. So what I'm going to do here is use the gauze just wrapped around, twist off, just in case there are any drips. I'm just going to pinch that with my finger as I clean off my cap here. And I'm going to flush with saline and check for blood return. Perfect. And I'll continue flushing. I'm going to leave that on for just a moment. I'm going to use my saline cap here to just cap that off. Got a pretty vigorous blood return here. Clamp that. All right, so now I'm going to take this. I like to stick the end of the tubing in my bag to get started. I'm going to open up my pump channels here. We'll get this all in my chemo waste bag. And then I'll unhang my flush and my chemo bag that are now empty. Put those in the bag. I'll go ahead and disconnect my flush. I'm also going to put my spill pad here in my chemotherapy waste bag. And at this point, I would doff my PPE per policy and also use my same chemo waste bag to dispose of that.